exposure.
Okay. Betty from Peoria asks us, she's a 69-year-old with diabetes and wonders if she will be able to get the H1N1 later. What do you think?
Well, with the diabetes, I think that puts her at a higher risk for complications, so that she certainly put at the higher list of or priorities for the H1N1 vaccine when it comes out.
Marge asks us, why does it take a week to diagnose, as we were talking about earlier, and get results for H1N1? Is the test sent out of Peoria? Is that what is necessary?
Well, I don't know if it gets sent out of Peoria. Amy, do you know?
Yeah, there are a few labs that are privately run that are running the tests. They're outside of Peoria. However, also the technology it takes to actually run the test, which is a real-time PCR test is what it's called, takes a while to run, and that's why it's not just the transit of taking the specimen down there, it's actually running the test itself and trying to locate that H1N1 virus.
And it's actually a different test that's run to rapidly test for the seasonal flu.
Very good. Dave from Glassford asks this question. He says, compare the seasonal flu to H1N1, and could you go over the counter symptoms? How do the two compare? Are they very similar? Somewhat similar?
They're actually very similar. You will have the significant fever, you'll have the cough, plus or minus a sore throat, body aches. They look very similar.
Well, and in treating the flu in general, whether it's seasonal flu or the majority of H1N1 cases, I understand that the treatment is most of the time over the counter. It's a lot of rest, a lot of fluids, and maybe some kind of pain reliever. As compared to the cold, would you guys actually prescribe something more for some of the colds that go around, or is that also an over-the-counter treatment?
I mean, really, for a healthy individual without risk factors who has an uncomplicated febrile illness, most of these children and adults will get over the infection, whether it's H1N1 or the flu, without complication and without antiviral treatment. There is a certain population, of course, that we would target to treat, especially those that are at risk for complications based on age or risk factors, chronic diseases. But really, for the most part, a healthy individual with an uncomplicated illness should do just fine and get over the illness.
You know, this year we also heard, I think it was this year for the first time, that when it comes to kids and coughs, that at a certain age, especially kids under 6 years, that those over-the-counter cough medicines really don't work that well.
Right.
As a parent, that's kind of hard to hear when they're listening to their child cough, and we're thinking, isn't there something else we can do for them? What do you tell parents?
Well, it's lots of fluids, rest, you know, some in certain situations maybe a little more humidity might help.
So put the humidifier on at night when they're sleeping, that kind of thing?
There was an interesting study that looked at usage of honey, a placebo, and dextromethorphan, which is a common cough medicine over the counter, to see which of those seem to help the cough the most. And believe it or not, honey won out. So I don't see any real downside to giving honey in children over 1 year of age. So if you want to give your child a teaspoon of honey every 4 to 6 hours, tastes great. But also it might quiet the cough and not have the downsides of a lot of the side effects from over-the-counter cough medicines.
Just make sure they brush their teeth afterwards, right? Right before bedtime, yeah, not so good for the teeth. Lorraine asks this question. She says her granddaughter is 14, had the flu. Can she get it again? So she's already had the flu once, and this is really just the beginning of the flu season. Could she be in for it again?
Yeah, I think it's possible. If she indeed had the H1N1 strain, we are yet to wait for the other strains to come, or other seasonal flu viruses, so it is indeed possible she could get a different flu strain this season.
Okay, we've got another caller. This time, Ron is calling in from Sparlin. Ron, you're on the air with DocsOnCall. What's your question?
My question is, I went through a stem cell transplant about 2 years ago, and I am on some of the anti-rejection drugs. I've already had the standard flu shot, and for the general flu shot every year, and I'm questioning if I should have the H1N1 vaccination or shot also.
Good question, Ron. What do you guys think?
I think it's really concerning that you don't get H1N1, and I would highly recommend that you get that vaccine. Provided that your oncologist had okayed you for the regular flu vaccine, then I would also obtain the H1N1.
Go ahead and get it. Charlene now is our next caller. She has a question for us. Charlene, you're on the air with DocsOnCall.
Yes, I have a 6-year-old daughter, and she was diagnosed 6 days ago with type A influenza, and I'm nervous to send her back to school. I'm wondering if, since she has had this, is she more susceptible to get it again, or is her immunity is built up against it to where she shouldn't be able to get it again?
What do you think?
Well, if she's doing better now, then presumably she'd have built up some antibodies to the strain that she received. But like Dr. Christensen said, there will be other strains out there that she and everyone else will still be susceptible to.
It's certainly for a parent, certainly natural for a parent to want to err on the side of caution and not rush their child back to school.
Absolutely. So just make sure that she's feeling well enough to go. I think that if she's still coughing quite a bit or extremely tired, I would keep her home, certainly. And during the second week of illness, I usually watch for secondary sort of infections, another fever or worsening cough, because that's what I'm probably more concerned about than anything, is developing secondary infections after the influenza. And I could really understand your concern about her susceptibility. So, if she does run another fever or get a worsening cough, she should seek medical attention at that time.
Joni from East Peoria says that an article recently stated that you shouldn't take Tylenol when getting the vaccine. And I think this story actually spoke of lots of vaccinations in general with our kids. When we take them to the pediatrician with their general vaccinations, we often give them Tylenol or some pain medication ahead of time. But we're hearing that might be problematic. Is that true? I mean, do you still recommend that kids get some pain relief when they have to get a shot?
No, not automatically, but certainly a dose of Tylenol will help with the aching that might ensue after that, or the low-grade fever with other shots.
But I don't think it interferes with a vaccine at all, so I don't think that's a major problem.
Vaccination should still be effective. Very
Correct.
good. Doctors, thanks so much for being with us.
Thanks
we
for
really
having us.
appreciate it. Jocelyn Pedrosa and Amy Christensen, thank you. And thanks to Methodist Medical Center for being part of DocsOnCall tonight. It is time for us to say goodnight. We appreciate your calls, and we hope you join us again on DocsOnCall in 2 weeks when the topic will be diabetes. Have a great night.